Hey everybody, Bones and I, we're back again with our friend Sarah, and we're going to talk about something that can be really scary. A lot of you have heard about ketamine, there's street ketamine, but we're going to talk about ketamine that's in a controlled environment. We're going to talk about what it is, what it treats, and what is it used for. So let's get to it. Ketamine can be very scary. You have special K, and you have the kind that we're going to talk about, which is where you get it in a controlled setting. So, Sarah, what exactly is ketamine?
Debbie, ketamine is a drug. So it's something that gives us both benefit and side effects. So we want to make sure that we're using it really safely because all drugs have side effects.
What forms is ketamine available in?
Ketamine's available in just about every form. From the least effective to the most effective, we've got oral ketamine. And so those come in what's called a troche or a troche. And it's a wax melt that you melt in your mouth, not in your hand. You rinse it around your mouth for about 20 minutes, spit it out, and it's about 10% effective. The next form that we can talk about is intranasal. So that's what you, like Flonase, goes up your nose. And that's about 48% effective. And the third way that you can take ketamine is through an injection. Like when you get a vaccine or an antibiotic shot, they inject it right into your arm or into your hip. And that's about 95% effective. The last way to get ketamine is through an IV, and that is 100% effective. Now, the reason that I like IV ketamine, besides the fact that it's 100% effective, is if you start falling into a K-hole, you can stop that infusion. So you have not already dissolved it in your mouth, it's not already in your bloodstream, you can stop it and have more control.
So what exactly does ketamine treat?
That's kind of a tough question. Right now, the FDA has only approved one ketamine for treatment, and that's called Spravato. It's also called S-ketamine. And they've only approved it to treat two things: treatment-resistant depression and major depression with suicidal ideation. And I know suicide gets really scary to talk about. So trigger warning, we will be talking about some suicide.
So when you say treatment-resistant depression, what is that?
A lot of people think treatment resistant means that you've tried 30 different drugs at 500 different doses and you've seen a psychiatrist and you've seen a counselor. That's not what that means at all. All it means is that you've tried 2 different antidepressant medications from 2 different categories of medications for like more than 6 weeks. A lot of people who take medication suffer from treatment resistant depression and just deal with substandard effects of meds. It's really unfortunate.
I'm sure some of you all are wondering, does health insurance cover ketamine if I want to go try it? So what's the answer to that?
So the answer is yes and no. Because the FDA has only approved ketamine in one form for 2 specific purposes, S-ketamine or Spravato for the use of treatment-resistant depression or major depression with suicidal ideation, insurance will approve S-ketamine or Spravato if you currently take an antidepressant and are having suicidal thoughts, or you have a depression score that's over a certain number. There are a lot of different things that we have to do to qualify people to be approved for health insurance coverage for that one form of ketamine. Now, again, covered doesn't mean free. It just means that you might have to meet your deductible, you might have a copay, you might have coinsurance.
So if you're wondering how much that may cost, what I would suggest you do is reach out to your provider, because those costs are going to be different based on where you live. So what can you expect when you come into a provider's office for ketamine infusion?
That's really, really good question. And here's the thing, it varies. So some offices only do non-invasive ketamine, so troches, intranasal, and you might have a private room or you might have a group room where many people are sitting together. You would expect your vital signs to be taken on a regular basis.
And when we say vital signs, we're talking about blood pressure, heart rate, and checking your pulse ox. And this means we're checking to see the oxygen that is flowing through your body.
We want to make sure that your heart and lungs are healthy enough to keep taking the ketamine, because if it becomes unsafe for your body, it's not going to be safe for your brain. So some other things you want to look for is you want to make sure that the provider that you're seeing is appropriate for the purpose you're seeing them. You want to make sure you're seeing a certified mental health provider for mood ketamine. It's okay to ask your prescriber if their clinic is specifically certified for ketamine treatment. You want to make sure that the people who are taking care of you are well-versed, certified, and trained to administer and treat your mental health disorder and administer the ketamine.
What are some other investigative uses that ketamine is used for?
Okay, great question. So ketamine is FDA approved as a Schedule 4 addictive medication. And it can be used really for three big things. One is short-term sedation. So when we get people in the emergency department and we need to set a bone, replace a dislocated shoulder kind of thing, we can 100% give them ketamine and they will go on a magic carpet ride while we fix them all up. But what we found is that it can also be really helpful for pain and treating pain. And that's done under the care of an anesthesiologist or a nurse anesthetist. And then it's also very, very helpful for mood. So the really nice thing about ketamine that's given in a provider's clinic is they get to be the judge of if you qualify for a ketamine treatment or not. While the FDA has only approved Spravato or S-ketamine for treatment-resistant depression or major depression with suicidal ideation, ketamine that's investigative for purposes can be given for post-traumatic stress disorder. It can be given for bipolar depression. It can be given for treatment-resistant depression. We give it for anxiety. If the provider feels like it's going to be a benefit to the patient, we're going to probably go ahead and investigate that.
Thank you all so much for coming by today. And thank you, Sara, for all the information about ketamine. We hope that you like, subscribe, and don't forget to come back and check us out. We're going to have a lot of information in the show notes for you. Until next time, stay well, my friends.
It doesn't matter which lead I put where because he doesn't actually have a heartbeat.
Don't be rude.
Are you kidding me?